Hello student, myself Sangeedha, Assistant Professor, Department of Medical Laboratory Technology, School of Allied Health Science. Today we are going to see about diagnosis cytology, in that interventional cytology. Cytology means the study of the cells, the purpose of detecting the early stage of malignant cells and abnormality of the tumor cells and squamous cells. Cytology diagnosis is the study of cells to purpose of detection the shed cells under the microscopic conditions. Classification of pathological conditions and morphological evolutions of the exfoliated cells and aspirated cells will see under the microscopic examinations. Used commonly for cancer screening and early detections. Also, it's used for screening tool and confirmatory test for cytology. Two types of cytology diagnosis is there. One is exfoliative cytology and interventional cytology. Exfoliative cytology is a diagnosis in fluid samples. Interventional cytology is a FNIC, aspiration of the sample in spontaneously. Interventional cytology in see about FNIC. FNIC means fine needle aspiration cytology. In that, FNIC is a technique where the cells are obtained from the lesions and thin using bone membrane and bone marrow samples. Smears are made for cytopathological diagnosis. This technique is mainly based for the tumor cells and easy aspirated samples used in the diagnosis of breast lumps, lymph, thyroids and subcutaneous soft tissues, salivary gland tissues and oral tissues. FNAC is a tool in clinical investigation. First important points, we have to investigate the point of the sample collection area, where it's located, like lesions where it's located, and transplantation, graft rejections or frozen sessions, like other the clinical subsessions of local occurrences and metastasis. Equipments. What are the equipments we need for the cytological is needles, syringes, pistol handle, sterile container, slides, fixative solutions, stains and microscope. What are the needles we need means 22 to 23 gauge needles used. Syringe is 20 ml syringe. Pistol handle is must important to collect the FNAC without contaminations. Also the grip of the handling. Sterile container. We have to store the sample in sterile container. We want physical salines or hands balance solutions prevent the contaminations. Slides. Slides should be clean, free and free of the grease. Fixatives. 70 to 90% of ethanols, formalins or formal or glutaraldehyde, formaldehydes, like so many of the solution is need for the fixatives. Stains. Stains is routine stains and special stains is also there for the FNIC diagnosis, like HNE, MGG and special stains are amyloid, Congo red, like so many of the stains is there for cytology. Microscope. Classification of the FNIC technique. We know about FNIC technique is simple and rapid. In that, we have two types. First one is FNIC with aspirations. If aspiration means we have to give negative pressures to collect the samples in a plunger. FNAC without aspiration means is a capillary method. We have to use just needles and collect the samples without the low atmosphere of the pressure. FNAC with aspirations. Fine needle aspirations with the aspiration is a diagnostic procedures. In that, needle should be plugged into the patients or lesions in area. It gives negative pressures. Negative pressure means lower atmosphere of the pressure, upper side of the, lower side of the lesions, under the swelling of the area. It should be aspirated cellular materials and collect the samples into the sterile container. Okay. Principle. What is the principle behind the FNAC with aspiration techniques? Application of the negative pressure. Must we need the negative pressures to collect the sample in syringe or plunger. Cells are delosed from the lesions. Where we have the collecting in the samples, in their cells are delosed and we have to collect using the negative pressures. Aspirated materials is smeared on the slides. Immediately we have to smear on the slides and use the fixative solution for fixing the smear. Stained and examined under microscopy. Procedure for the FNAC with aspiration samples. The patient positioned comfortably and the skin over the swelling is cleaned with the antiseptic solution. First, the patient should be instructed to follow the comfort zone and use the antiseptic solution to clean the patient's lesions area or wound area. The lesion is fixed firmly between the fingers to prevent movement. We have to check the movement or abnormalities in the lesions area or wound area. 22 to 23 gas needles attached to a 10 ml syringes is inserted to the swelling area. Once inside the lesions, negative pressure is created by pulling back the plunger of the syringe. When syringe is introduced to the patient's lesions, then negative pressure is created. Use the plunger of the syringe. The needle is moved back and forth the different directions within the lesions without withdrawing the completely. We have to introduce the needle completely, creating the negative pressures, allowing the cellular materials to enter the needle hub. After adequate material is collected and the negative pressure is released before withdrawing the needle. When we are collected the samples and then we have to release the negative pressure, lower atmosphere pressures inside the lesions area, and then collect the samples to prevent the contaminations of the needle tract. The needle is then removed from the lesions. Aspirated material is expelled onto the clean glass slides. Then smears are prepared by gently spreading the materials. The main objectives of the sample is collecting using negative pressure. FNAC in with aspirations mean we have to create the negative pressure and collect the samples without using anesthesia. The smears are immediately fixed in 95% ethanols for wet fixations or dried depending on the staining method. Finally, the pressure is applied puncture site to prevent the bleeding and small dressing is placed. Prepare the slice, then sent to the laboratory for immediate stain and cytological examinations. Final, the procedure, simple procedure for the FNAC with the aspiration technique is first, patient should be positioned comfortably and then using the antiseptic solution to cleanse the area of the lesions or wound area. Then, needle is introduced to the swelling and gently move to furrow and collect the material using the negative pressure inside the lower atmosphere of the bodies. Then air is taken from the syringe, then needle is reattached to the slides, then collect the materials and gently passed to create the smear and fix to the fixations, then stained, routine stains or special stains and observe the cells under the microscope. This is a simple procedure for FNAC with aspiration techniques. Then FNAC without aspiration is a simple and rapid protocol for the FNAC technique. FNAC without aspiration is called non-aspirations or capillary technique. In that, we don't use the negative pressure to collect the materials without contaminations. Here we use the capillary technique. It's a method where cellular material is collected without applying negative pressure. Already told that we don't want to create the negative pressures to collect the materials in the aspiration technique. This technique is released on capillary actions of the needle. Is commonly used to highly vascular organs like thyroid to reduce the blood contaminations. Principle. FNAC without aspiration works on the principle is capillary action. There is no negative pressures or lower atmosphere of the body fluids. Cell materials enter the fine needle naturally due to the capillary pressure without applying the negative suctions. The collected cells are then smeared on a slides, stained, examined under the microscope to diagnose based on the cell morphology. FNAC without aspiration was first introduced by Jasdilla in 1987. Based on the observations that capillary pressure inside the fine needle is sufficiently to keep detached cells inside the lumen of the needle. Here, first we introduce the needle into the lesions area, then we don't want to give the negative pressure, just we use the capillary actions. We collect the samples and then we introduce into the clean slides and then make a gentle pressures to create the smears. We just saw the two methods, FNAC without aspirations and FNAC with aspiration. It's a simple technique, and one more the technique is ultrasound technique. Last two method, FNAC without aspiration and FNAC using with aspiration. These two methods are simple and rapid method. Here we want to use ultrasound for the find out the real cells and real imaging to use the lesion guidance to find out the lesions suitable guidance for ultrasound. If a suspected tumors in the deeper planes cannot be seen or felt by physicians normally or physical touch, the patient is asked to get an ultrasound guided biopsy. High frequency sound waves is applied. The reflection of the wave from the tissues interfere is recorded as the construct the image. When we use the ultrasound to the lesion area in that multiple wavelengths to create the deep planes and from the tissues interface with the construct the image of the lesions into the deep cells. Here we using the ultrasound introducers find out the area of the cell collections and collect the samples using the syringe. The technique. What are the technique we have used for the FNAC using ultrasound? This is a simple and deeply inside protocols. The longest part of the examination is identify the lesions and position of the patients, identify the site of the puncture and directions of the needle. We have to first find out the lesion area and puncture site from the patients. The deep lesion is from the skin surface is measured, determine the length of the needle required. Continuous real-time ultrasound is used to visualize the needle entering the lesions. When we are using the ultrasound to the lesions patient's area, in that we can see the how the entering of the needle into the lesions area. Also during aspiration, to ensure the needle stays within the lesions, and we can see the needle is inside the lesions and citation of the puncture site is correct or wrong. Here the procedure for ultrasound using FNAC technique. The transducer ideally held in the optimal longitudinal positions. The patient should be positioned in longitudinal optimal conditions to visualize the lesions comfortably. Prior to inside the needle, the alignment of the transducer is checked. We have to check the site of the puncture area using the ultrasound. The real-time guidance, the needle is introduced to the skin 1 to 2 cm proximal to the transducer, then the advanced along the line of the transducer. The length of the needle should become the visible tip, and this used puncture lesions then is inserted few more millimeters. Just be using the ultrasound, then we have introduced the needle to the correct positions and how much deep inside is needle is focused. It is only when the needle is lesions are lined that successful punctures can occur. Here we can see the lymph node aspiration technique using the sterile the conditions and the sample is collected with using the pressure. Is this a technique of fine needle aspiration with the aspiration technique? Is this the fine needle aspiration without aspirations? This is with aspirations and this is the without aspiration technique. The sites where we have to collect the FNAC. Simple sites: thyroid, non-thyroid neck, breast, liver, lymph nodes, lung, gastrointestinal tract, mediastinum, pancreatic mass. Yes students, we see about the FNAC techniques, procedures and how the sample is collecting in the two procedures, FNAC with aspiration and FNAC without aspirations. Also we saw about the ultrasound using FNAC technique. Here final the step, smear preparations. How the smear is preparing? Direct smear and indirect smear. Direct smear is two methods, dry and wet. The sample is collecting creamy appearance, creamy consistence means, and number of cells suspended in a small amount of the tissue fluids. Wet smear means smaller number of the cells suspended in a fluids or blood. Then indirect preparation means thin fluid samples are best processed by the centrifugations on the side of centrifuge. The sample is collected and then centrifuged to make the thin fluids and then make the smear is indirect preparations. Direct preparation is collect the samples and make the smear spontaneously fixed to the fixative solution. Here 2 points, direct preparation and indirect preparations. Direct is two method, dry and wet. Collect the samples, make the smear prepare immediately and fix the smear spontaneously and examine the microscope. Thin fluid sample is indirect preparation. Collect the samples, centrifuge the samples, make the thin fluid preparation and then make a smear fixed to the fixative solutions and then follow up the staining and protocols. The procedure for the smear preparations. Here we have to take the label slide we have to label the patient's name or patient's UHID number, and then add small amount of the samples. If we are using direct method means directly add the samples using the needles. Procedure for the smear preparation. First, we have to take the dry and grease-free slides. Then we should label the slides using the patient name or patient UHID number. And then we have to add the small amount of the materials or samples. If we are making the smear direct method means directly we have to add the sample using the syringe, or indirect preparation means centrifuge the samples and then collect the samples to make the prepare slides. Then prepare the smear using the another slides to make gentle prepare of the smears. And then after the smear preparation, introduce to the fixation immediately, like 70 to 90% ethanol or formalins. And then you want air dry slide means we have to dry into the laboratory area without contaminations. Then finally we introduce into the staining area. Fixatives and staining. What are the fixatives? We are seeing 70 to 80% of the ethanol is there. Formalin, glutaraldehyde and formaldehyde is there, and used fixations to contaminate, to prevent the contamination and putrefaction of the bacteria. Then what are the staining is routinely we used for the FNAC means HNE, May granule Giemsa stains, Papanicula stains. Why we are using Papanicula stain means the technique is first find out by the Papaniculus sir. He was the first man to introduce the FNAC technique. So the stain also he is founded, and the stain is first majorly used for the identification of the abnormality cells. And alcohol fixation staining according to the PAP with the HNE. Romanowski stain. Romanowski stain was first introduced by Sir Romanowski. 5 types, Jenner, Giemsa, and so many of this there. In that we are using Romanowski stains. The staining content is methylene blue, Assure B and eosins. These are the basic and acidic dye. Romanowski stain is made up of neutral stains. Is dissolved to the acetone-free methanol. Include the Jenner, Giemsa, May granule and Giemsa stains. Already I told that is there are 5 types: Leishman stain, May granule, Giemsa, Jenner, and then Romanowski. It's the 5 types is there. In that we using these stains to find out the abnormality cells in the FNAC samples. Final the result is we see the nuclei in blue or purple, cytoplasm is pink in blue, pink or blue, eosinophils is pink or red. In that we have to see the purple color is the nucleus cells. Papanicula stains is a multi-dye stain is there. The name is multi-dye stain. The content is Harris hematoxylin, orange G6 and EA50. These are the major stains find out the abnormality cells inside the collecting materials in the FNAC samples. The result is nuclei is blue or black, cytoplasm is blue or green, keratinized cells is pink or orange. May granule Giemsa stains. May granule Giemsa stains commonly used stain of blood smears, peripheral smears and FNAC. The content in the May granule Giemsa stain is methylene blue is a basic dye, Assures B is also a basic dye, eosin and acidic dye. The result of the MGG stain is nuclei of the white blood cells and the granule of the basophil granulocytes is a blue in color. Red cells and eosinophils granules are red in color. Cytoplasms of the white blood cells is light blue in color. PAS or Alcian blue stains be used to find out the mucin and glycogens materials also we have to see under the Alcian blue and PAS. PAS means periodic acid shift reagents. Prussian blue. Pearl's Prussian blue stain is only used to identify the iron deposits inside the FNAC samples. Mason Phantom stain. Mason Phantom stain used to find out the melanin pigments. Using the melanin pigments, the cells or deposits and background of the melanin cells are deposited, and Mason Phantom stain. Mason Phantom stain is used to find out the melanin pigments. Conco red stains. Conco red stains is used to find out the amyloid red cells. Zeal-Nelson stain. Zeal-Nelson stain is name of Zeal-Nelson author discovered the acid-fast bacilli stains. Is 2 method, cold method and warm method. Cold method is using the 5% sulfuric acids, and acid method, it's a warm method, is using 25% sulfuric acids to find out the bacterial cells inside the FNAC materials. Bile pigments. Bile pigments we have to find out the Faucher's reagents and counter stain using the Faucher's reagents. Cellus rate. Gram stains, pass stains or Gromary silver stains used for the microorganisms. Microorganism, we can see about the three methods, three type of stains: gram stains, acid fast stains, Gromary silver stains. We are using the Gromary silver stains to find out the spirochetes. Advantages. What are the advantages is in the using of the FNAC technique. FNAC is a simple technique and rapid technique diagnosis. Economically is easy and sampling from the multiple sites in the same sittings. High diagnostic accuracy. Many techniques such as bacterial culture, immunocytochemistry, flow cytometry, cytogenetics, polymerase chain reactions are possible from the FNAC materials. Limitation. Loss of tissue architectures. Capsular invasions and lymphovascular invasions cannot be detected. Difficult to differentiate in cyto versus and invasive carcinoma. Considerable training is needed for the accurate interpretations. We need the proper trained persons to collect the samples and give the accurate interpretations of the results. Complication. What are the complications we face under the FNAC technique means? Usually free of complication. These bleeding, hematoma, emphysema in the lungs areas. Rarely anaphylactic reactions, accidentally rupture of the hydrated cyst. Yes, students, we see about the FNAC techniques in three methods. One is with aspiration, without aspirations and ultrasound aspiration. In that, how the sample is collecting, simply we can summarize the FNAC technique. First, FNAC cytology is a study of cells to detect the abnormal cells inside the lesions. Three methods: FNAC without aspiration, with aspiration and ultrasound aspirations. Without aspirations is capillary method. With aspiration is a negative pressure using the collect the materials. Ultrasounds to use the collect the samples in correct manner or correct lesions area and collect the samples in the needle aspirations. Smear preparation. There is a two method, dry and wet. We prepare the smear and fix to the fixative solution is a wet method, and dry the smear is make the smear and allow to dry in the laboratory area without contamination and then introduce into the routine solution and special stain is there. The routine stain is HNE stain, May granule Jimsa stains or Romanowski stains or perpendicular stains. The special stains are PAS stains, amyloid stains and Ziehl-Neelsen stains. Also except of the stain is there. Last, we see about the limitations and advantages. Its diagnosis is economically easy and rapid diagnosis. Also, it's a confirmatory tool for the detecting of the cancer cells. Limitation is we need proper trained person to interpret the results carefully. Some complication is bleeding, hematoma or emphysema in lung area. That's all the FNAC area. Thank you, students.